Well, the pressure on hospitals remains profound and is affecting the care not just of coronavirus patients, but as we heard, other patients too. Over 5,000 armed forces personnel are now helping out in hospitals and vaccination centres across the UK. And the government is warning that the numbers of cases remain dangerously high, despite some indications that the rate of infection may be shrinking. Well, Dr. Ian Higginson is the Vice President of the Royal College of Emergency Medicine, and he joins me now. Good afternoon to you, Dr. Higginson. And I suppose this is just it, that we're in this phase whereby the numbers may seem to be plateauing a little bit. Maybe the epidemic here is shrinking, but the situation in hospitals really remains very, very serious.
Yeah, I think you've had some very fair summaries. I think there are some lights at the end of this tunnel, but I think that right now the tunnel's pretty dark. There's some pretty scary monsters in there, and we're not quite sure how long it is. And we've got to keep going cautiously along as best we can, but we're not there yet.
How would you characterise how the health service is coping?
The health service is coping as best it can, and in most cases remarkably well. I think it's pretty safe to say that it's pretty horrible almost everywhere, and in some places it's frankly awful. But we know we've got an amazing health service with incredible staff who are frankly exhausted at the moment, but they are doing the best they can for all our patients.
And we've been hearing a lot from them in the last few days across our outlets. We do know, of course, that the effect of the pandemic is not only on coronavirus patients, but on people who want to use the NHS in other ways too. And in Northern Ireland, as we've just heard, some cancer patients are having their surgery put on hold. I mean, that's really serious.
Yes, and obviously my speciality is emergency medicine, and we feel for all patients who've had any aspect of their care delayed. From our perspective, we would urge patients who believe they're suffering from a significant illness not to be afraid to come into hospital, particularly patients with potential heart attacks, strokes, major trauma, bad tummy pain, uncontrolled bleeding, that sort of things. Emergency departments are still open. We are very busy, but we do still want to see those patients who may be critically ill.
What are the numbers like in emergency departments at the moment? Are they lower than they would normally be?
It depends where you are. In some places, the overall numbers are lower, but the number of sick patients are higher. And in other places, it's a slightly different story. All emergency departments are busy. How much of that is due to COVID does vary a bit around the country from day to day.
But would you say that you are seeing signs of people being reluctant to come to emergency? Because we know that happened in the last lockdown.
We're seeing some signs of that, yes. There's some evidence around patients with potential heart attacks, for instance, and it does worry us. And that's why we're encouraging people not to be afraid if they believe that they are seriously ill to come to our emergency departments. We are still open for business for those patients who believe they are seriously ill.
Okay, very clear message. Thank you so much. That's Dr. Ian Higginson there. Thank you for your time.
Thank you.